Hi, Dr. Roy Hall here with Mountain Health Functional Medicine in Billings, Montana. And I understand you're looking at regenerative medicine to help you get you out of your pain. And I'm going to say good choice because we have some very good results with regenerative medicine and pain issues. What I want to talk about in this little video is FAQs, or frequently asked questions that people ask about stem cells or regenerative medicine. First question that people ask is, where do you get your stem cells? What kind should you use? What kind is going to be most beneficial to me? And first off, there's two places we can get stem cells. One, it's from the patient, and that's called autologous. Number two, we can get it from another person. Okay. Now, autologous, we have two places we can get the stem cells. One, we can do a bone marrow, a biopsy. That's where we stick a needle into the tailbone and suck out the blood, and there's a lot of stem cells in there. Now, I was a medical oncologist for 32 years, and I did a lot of bone marrows on everybody with leukemia, Hodgkin's lymphomas, even breast cancers, lung cancers. And I tell you, nobody ever volunteered to have that thing done twice because it hurts like the devil. The other place we get stem cells from is our fatty tissue. So the doctor can stick a needle into the fat, suck that out, separate the fat, and there's some stem cells in there. The problem with autologous stem cells, and that's either it's from fat or blood, is that as we grow older, we have fewer and fewer stem cells. I'm 66, and the studies show somebody my age, it's like 1 out of 1,000,000 cells is a stem cell. The other place we get stem cells is at birth, and there the number of stem cells is like 1 out of 10,000, so a big difference in number of stem cells that can be harvested at one time. Now, before you get upset, it's illegal the last 20 years to get stem cells from aborted fetuses. That went out in the 90s. We can't do that in the United States anymore. But Roy, you just mentioned getting it at birth. Well, yes, we go to birth and take it at birth. And there's two places to get these stem cells and growth factors. And one is, if you remember in biology, you got the baby covered by the amniotic sac, and what's surrounding the baby is amniotic fluid. Well, at birth, and it's a C-section. At birth, they stick a needle into that sac, draw out the amniotic fluid, and get the stem cells out of there, and other growth factor. The other place at birth we can get stem cells is the umbilical cord. And this is one of the better areas to get stem cells. And what they do is they harvest the umbilical cord, and inside that cord you got two veins taking the blood from baby back to mom, and the artery taking blood from mom to the baby. But all in between those three blood vessels is a lot of fluid, and it's called Wharton's jelly. A lot of stem cells in it. Now, both these situations, the stem cells are harvested at birth. And what I mean is it has to be a planned C-section. They have to have time to test mom, test the baby to be sure they're healthy so that the stem cells you get are healthy and you don't come down with any infection or complications. So it's got to be a planned C-section, and it cannot be that C-section where the young mom goes in at 8 o'clock for a vaginal birth, and at noon she's not progressing. And the doctor says, I got a golf game at 2, so we need to do the C-section at 1. That doesn't count, and you can't do it with a vaginal birth because with vaginal births, the umbilical cord can get damaged. So that's where the stem cells come from. Another question people ask often is, how many treatments do I? Well, in most situations, particularly issue with pain in one joint, or a couple of joints together, it's one injection into that area, or one treatment in that area. And that injection may consist of 2 or 3 needle pricks in that area, but it's one series. Whereas people with things like COPD or rheumatoid arthritis, we tend to give multiple injections, but it's over a period of multiple months. So most pain issues, for joint issues, it's one injection. Another question, how long have we been doing it? Well, my clinic has been doing stem cells now for almost 2.5 years. We're probably the oldest clinic in Billings doing it. I don't know about the rest of Montana, but if we're not the oldest, we're one of the older ones in Montana doing stem cells. Next question people ask, are there any reactions to this? And basically, the only reaction is the needle poke, the little discomfort. We don't see any nausea, vomiting. We don't see fevers. There's no rejection like you do with a liver or a heart. There's just no transplant or no reactions. And then the next question people ask, well, what's the worst thing that could happen? Well, because there's no reactions, really the worst thing that could happen was it just didn't work with you. But what the studies show, it's effective in over 80% of the people. And that's one injection. So the success rate is extremely high. Next question is, does it hurt? I probably shouldn't tell you this, but we don't use any lidocaine because the lidocaine, as we inject the skin and the tissue underneath the skin, because it's very acid, that lidocaine can kill the stem cell. What we do when we inject you is we numb the outside of the skin with some cold material, it's chloride, make it really cold, so when we poke you with the needle, you don't feel that poke. And we get into the area quickly, and I have to tell you that it's probably less pain than having your blood drawn. And I had stem cells injected in my knee a couple of months ago, again with no anesthetic, and yes, I felt the needle, but it wasn't hurting, and I didn't have to jump or do nothing. Last question people frequently ask, does insurance cover it? Well, you know the answer, and the answer is no. Insurance does not cover the treatment with stem cells, regenerative medicine, and I really doubt they ever will because people don't realize it's the drug companies, the hospitals that tell the insurance people what to cover. And there's way too much money being made off those surgical procedures to cover something this minute in terms of cost. So I doubt they ever will cover. And I have to tell people, as long as you say, I can't do this, whatever this is, because my insurance won't cover it, you're really doomed to getting the same care you're getting right now, to get the same pain medicines over and over, to be recommended to have surgery or for joint replacement. You got to jump out of that box, take financial responsibility, take self-responsibility. So I hope I've answered some of your questions about stem cells, regenerative medicine. We hope to see you in our clinic. Why don't you just call, make an appointment, let us talk about the options for you and see what we can do for you. Our number is 406-969-6310. Thank you. Bye.